For Agriculture Today, I'm Charles Craig. We have with us today Dr. Tiffany Lee, a veterinarian and PhD student working with the Beef Cattle Institute. She is here to talk to us about a recent survey that was conducted about health and well-being recommendations of feed yard veterinarians. Tiffany, tell us a little bit about this survey and how it came about.
Well, I think this survey has a pretty interesting history. We really wanted to figure out what these veterinarians were recommending out in the field. We have a lot of literature from academia, but we didn't have a lot of actual research that was done of veterinarians that were working in the field. So we did a little digging, and in 2007, there was a survey of consulting nutritionists out of Texas Tech University. And we were like, you know what? This is a great survey. We think we can model a survey for veterinarians. Mm-hmm. So in 2009, they actually completed the first survey of consulting veterinarians. And this survey that we did in 2014 is a repeat. We want to basically repeat it every 5 years to see if there's any changes in the recommendations that these veterinarians are making throughout the industry.
And where was the geographical placement of this survey done in?
Well, we wanted to get a good representation of most of the consulting feedlot veterinarians in the United States and in Canada, because they have quite a bit of feedlot cattle in Canada as well. So we had 23 participants, 19 were from the United States, 3 were from Canada, and we kind of had a pretty good representation. We had veterinarians from Oklahoma, Texas, Kansas, Nebraska, Colorado, and Idaho as well.
And what were some of the major changes that you saw from 2009 to 2014?
You know, surprisingly, we didn't see a whole lot of changes. It might be with our, smaller sample size, just the 23 veterinarians. I think the biggest changes we saw were in the recommendations as far as not even recommendations, basically just the way that veterinarians are thinking about what causes morbidity and mortality in these cattle. We did ask them to rank 7 different factors that they thought contributed to mortality. And actually, those changed pretty significantly from 2009 to 2014, mainly in the areas of whether they thought labor or weather patterns really had an effect on morbidity and mortality, which was pretty interesting.
Yeah, definitely. And I know castration played a big part in this project. Can you tell us the proper recommendations for each weight class?
Sure. We don't really have a proper recommendation across, the whole country. There's lots of people that make different recommendations, but the general consensus from this survey kind of showed us that cattle got heavier into those heavier weight classes. The veterinarians were recommending banding more often, just to get away from that surgical, the risk of bleeding gets higher as you increase that weight. As the weight class went up, the percentage of veterinarians that recommended banding also went up. But if the cattle were, 300 pounds or under, most veterinarians were recommending surgical castration, which is what the industry really recommends. They're strongly pushing. So.
Right. Were there any specific diseases that were focused on in this vaccination process?
A lot of the veterinarians, we did ask, vaccination protocols, what they recommend. Most of the veterinarians recommended a good, broad modified live vaccination for respiratory disease. Every single veterinarian that we surveyed did recommend vaccinating against IBR. And then BRD was a close second. And then some of the other respiratory diseases, PI3 and BRSV, we also saw quite a few veterinarians recommend vaccinations for those.
Can you tell us some recommendations that veterinarians give for best management practices?
Well, as far as best management practices all across the board, I think all of these veterinarians are making recommendations on antibiotic use, euthanasia, and a lot of them are actually working with their consulting nutritionists as well, and both of them are making recommendations, which we really like to see that cooperation. And I think that as time goes along, we'll see a lot more veterinarians making recommendations for the best management practices in the future.
What's the overall mission statement that you would say for this survey?
I think the thing that we wanted to get out of this survey was to really understand what the major group of consulting veterinarians is recommending at this time, and to see, if there were any differences as far as geographical region or anything like that. And the biggest thing is really to track the changes that were made from 2009 to 2014. It'll be kind of like a timeline record to see how these changes, these recommendations will change as the industry, moves forward in the future.
Definitely. And through this process, was there any antibiotic changes addressed in this survey?
There were not any big changes. We did see some veterinarians that were recommending, for example, metaphylaxis in more high-risk calves rather than the low-risk calves. And I think that that's, it's a good show of antibiotic stewardship on our part as veterinarians. We don't want to use antibiotics when we don't need to. We don't want to contribute to resistance, and I think that we're doing a really, really good job. I think one thing that will be important in future surveys is maybe addressing the issue of the veterinary feed directive. I think we'll probably include some questions about, how that's impacted practice and how these veterinarians deal with it. And it'll be an interesting thing to see on the next survey.
Yeah, definitely. Well, thank you so much, Tiffany. And that was Dr. Tiffany Lee, who is a veterinarian and PhD student working with the Beef Cattle Institute, talking about the survey on cattle health and well-being recommendations made by veterinarian consultants. For Agriculture Today, I'm Charles C. Craig.